Hello, Tom. I can't wait to hear this tonight. Boy, so many people have something at stake with this. Listen up.
Hey everybody, we're live and we're going to have an interesting, really good discussion tonight. My name is Tom Jones, I'm the pharmacist, and this is Today with Tom. And we're going to talk about something that practically a lot of people take. And did you really know all the facts on this? And yes, it's about levothyroxine, probably the #1 drug in America today. And did you know all the things that I'm going to be telling you tonight? Number one, I want you to promise me one thing. Even if I give you some facts that you don't know about, don't stop taking your medicine, because being able to take levothyroxine is a privilege, because without taking it you have no energy, you would not be in good shape, you would be lethargic, and it's for your health. But I want to just kind of drive something home to you. About 20 years ago, I started studying about natural medicine and functional medicine and all the different things that we didn't learn in pharmacy school. And hey, Robin Reagan Thompson, thank you so much for joining us tonight. And as you come in, just let us know you're here. I know we have a big audience. We've got a really, really good audience. We've got a very loyal audience. And I always tax you by just coming on at different times during the day. But we are really proud to have our audience. And hi there to you, Robin. I really am appreciative of the fact that we do and are telling you things that are good for your knowledge. But promise me one thing, you gotta continue taking your medication, because if you don't take it, you have more problems than you can ever imagine. But what I'm going to talk about tonight is something that we really don't talk about much. And that's about drug nutrient depletion and all sorts of things that go along with taking your medications. And that's what we're about. My name is Tom Jones. I'm a pharmacist. I'm a science-based individual. I like to see clinical studies. I like to see all the things that's going on as far as a chemical's life. And I'm talking about a pharmaceutical chemical. You need to go and learn how things work and how your body works. And then you'll understand why it's important to take your medicine on a regular basis under the same circumstances and follow the doggone directions. If it says on the empty stomach, there's a reason. If it says take it with food, there's a reason. If it tells you and gives you the warnings that you need to be following, listen up. Follow the directions. Become knowledgeable. Become the individual who really is a take charge individual. But we're going to talk about drug nutrient depletion, and there's a lot of things that most people don't realize. Every drug has an effect on the body. It works in different ways. Each individual chemical is chemically different than the other chemicals and ingredients out there. So, if there's a reason to be careful with medications, there is, because they have effects and they have side effects. And you've got to be knowledgeable about what they are. And because so many people take medication today. A long time ago, they didn't have the medicines. A long time ago, we had to go with what was known, and we didn't have the internet. We didn't have all the manufacturing facilities. We didn't have as many chemists as there are today. We didn't have the educational know-how to get all this information out. And thank you to Renee Squires Ford for being here tonight. Thank you, thank you, thank you. But now we do. Now we do. We got to take that knowledge and step it up a notch. That's what everybody has done as far as the drug companies, as far as the FDA, as far as the DEA. We've got to take our knowledge to the next level. And we talk about the next level a lot. But knowledge is important. Knowledge helps you be a better individual. Knowledge will actually facilitate you staying well. Knowledge is what it's all about. And that's what I am here to do. I'm here to coach you. I'm here to educate you. I am here to consult with you. I'm looking at you one-on-one right now. And promise me you'll continue taking your medication and even take it better than you have in the past, because I'm going to teach you some things tonight you may not know. But this is going to be a forte of mine, because 20 years ago I met with a couple of pharmacists, and they actually have gone far in the fields. One gentleman's name was Ross Pelton. He was a pharmacist, but he also was very trained in drug nutrient depletion. The other gentleman was a pharmacist also. His name is Jim Lavelle, and he is a pharmacist and a naturopath physician. And Ross, Mr. Pelton, has many, many credentials also. But they taught me about drug nutrient depletion back in the early days, back when nobody was talking about it. They wrote the book. And they have educated people and pharmacists and doctors and nurses, all of the medical professions for so many years now. 20, 30, 40 years has been their training and ability to give out new information. That's what I like to do. I like to be the sponge on the wall and get all the new information. And I see some hearts of thumbs going up. So, this is the key. This is the key to life anyway. Knowledge helps you understand and reason why, because you do things in a balanced way also. So balancing your life is one of the key aspects that I'm going to preach day in and day out. And I am here to teach you and to help you be a better individual and be a better ambassador for your health. So, all right, how does this kind of play into things? Well, drug nutrient depletion simply means that you need to be aware that vitamins and nutrients can interact with a pharmaceutical. Other pharmaceuticals also interact with pharmaceuticals. So you have the drug-drug reaction, you have the drug-nutrient reaction. And that's key important in the processing. And you have systems. You have systems and drugs not interacting well together also. So the process of drug nutrient depletion and drug-drug interactions and drug system interactions is very, very important. So as we take more medications, and probably 50%, I think the latest stats say a little bit over 50% of every American, and we're talking around the world, so probably this goes all the way around UK and the Philippines and Russia, China, all over the world. People take lots of medications, and there's lots of interactions, lots of them. And, we don't really talk about it as much, and we kind of mention it. When you're a busy pharmacist, you don't have the time to tell everything you want to tell. When you're a busy doctor, you don't have the time that you want to tell everybody and actually be benefiting everybody. I'm taking a sip of water. But here I'm able to talk one-on-one with you. So promise me you won't quit taking your medication, but let's go over some of the interesting points about a simple drug, the number one drug in America right now, levothyroxine, and a drug nutrient and a drug system interaction. And actually, that's really, really, really important, because the more knowledge you have, the better you'll understand. All right, let's talk about levothyroxine first. All right, thyroid, it's synthroid, it's levoxyl, it's uteroid, it's generically available as levothyroxine. Way back in the early days, there was only synthroid. And then there became a battle for who was going to have the top selling drug. This was 30, 40 years ago. And actually, synthroid, for a long period of time, was the only drug that most physicians would even write, because the pharmaceutical reps who educate physicians, in a lot of cases, were promoting synthroid as the only thyroid. But today, there's a lot of people who take the different kinds of medications. Okay, all right, so here's kind of how the deal is. Levothyroxine or synthroid or levoxyl or uteroid or any of the other thyroids, and actually you have, that's levothyroxine, which is T4. T4 is your non-active form of thyroid. T4 has to be converted in the body to T3, which is is the active form of thyroid and what it actually gives us as far as activity factors in the body. So you get the stimulant effect when you run down and you have no energy and all that good stuff. All right, but anyway, let's talk about all the processes here, because it's used to treat hypothyroidism. And there's an epidemic of hypothyroidism in the world today, in America today. And it's also used to treat Hashimoto's disorder, which is an autoimmune type situation in the body. And it's to help prevent a goiter also. And it can be, so levothyroxine is a hormone, and actually it can be caused by hormonal imbalances, radiation treatment, surgery, and cancer. So, one of the items that the body has less of when levothyroxine is concerned is calcium. So, urinary increased calcium loss has been associated with levothyroxine. So, but now there's an interaction between the calcium and the thyroid. So you don't want to take your vitamins at the same time. So 2 to 3 hours after, or maybe even more after the meal, on an empty stomach is when you take the levothyroxine. Or if you're on Armour Thyroid, which has levothyroxine in it, it also has the iodothyroxine, which is the active T3. So you got T3, T4 in Armour. You've got T4 only in the synthroid and the levothyroxine, which is all one product. So, all right. Another key element here is soy. Soy products can interfere with thyroid absorption and utilization. So now you enter into the era of being careful how you and what you eat along with levothyroxine. So the first thing is empty stomach, first thing in the morning typically, and making sure you have no soy with the actual medication. All right, so you really need to take, therefore, the thyroid, the levothyroxine, between or away from the meal time, preferably on an empty stomach. So that's one of the key reasons why it's so valuable and so important and so necessary to get the optimal effect of your levothyroxine, because interference with food, and particularly soy, will decrease the activity. So, and there's all sorts of other indications as far as over-the-counter medications that have been shown to interact with thyroid medication. So, whoa, hold the phone. We got lots of other issues popping up. So, common cold medications like 12-hour cold antacid, Advil cold allergy, Allegra, and female hormone, the old Premarin formula, conjugated estrogens, actually interfere with the levothyroxine. Isn't that interesting? In fact, drug.com, which is an authority actually with drugs and drug interactions, lists 486 different interactions between levothyroxine and drugs and some multiple vitamins. Did I say 486? Well, the one thing I want you to remember is do not under any circumstances stop taking the drug. But I want you to take it more responsibly. Empty stomach, between a meal, preferably early in the morning, because you want it to work as effectively as it can possibly work. Also, it's super duper super imperative that you take your multiple vitamin at a different time, because if it's got calcium in it, whoa, got problems. And there's other nutrients that play a role in the thyroid process. So, all right, because the calcium-containing products will actually decrease the oral bioavailability of the levothyroxine by about a third. So if you're taking, all right, let's go back in that one more time. If you're taking 90 milligrams, you're getting the effectiveness of 60 milligrams. And, uh-oh, I thought you wanted to have energy. So if your vitamin comes, suppose you take it first thing in the morning. Suppose you're taking it on an empty stomach. But then you take the vitamin along with it. That other problem arises, because if the vitamin has calcium and there's other ingredients and nutrients in that vitamin combination, you're going to have less activity of your thyroid, so therefore you're not going to have as much energy, you're not going to feel as good, and it's not as good for you. So the key to this is you've got to know what affects the hypothyroidism, and in this case, the hypothyroidism drug. And there's no other drugs out there. You really don't have any alternatives to this. Insurance companies kind of dictate what drugs you take anyway. So what happens there is that there'll be significant decreases, and if you go have your labs taken, there'll be significant decreases in the amount of the free and total levothyroxine or thyroxine in the blood sample test. And there'll be an increase in the thyroid stimulating hormone, which is the TSH, following the administration of calcium carbonate, say a 1,200 milligram dosage. And that's the dosage that's in most osteoporotic and osteopenia type prevention medication thyroid calcium products. So, supplying the active ingredients, the nutrients that you actually need to actually get your levels back up. Here's another area that you really need to be very, very intelligent in, and that is what other items along with the levothyroxine is going to be beneficial for your thyroid action in the body. And it's real simple. You've got selenium, which is a nutrient. You need about 200 micrograms per day. That's micrograms. You also need about 15 to 25 milligrams of zinc every single day. And a lot of people in the United States have a deficiency in iodine. So, and this is in the form of sea vegetables and a combination of iodine, iodide, and these preparations will actually be beneficial for someone who has a lower thyroid amount in their body. The iodine will be the important aspect of this, and is needed for proper thyroid hormone production and function. And you can have an iodine test that will determine the proper supplementation of the iodine. And one more key element. We haven't even finished this. Iron levels will actually be needed to be up to their normal levels for, or that can actually lower the thyroid hormone production. Iron should be taken also 4 hours or more from your thyroid or levothyroxine dosage form taken. So, isn't that amazing? At least, according to drug.com, 486 different drug nutrient reactions, actions, problems, interactions, and deficiencies occur because of the levothyroxine. I bet you are blown away. I was actually when I first heard this many years ago. And drug nutrient depletion is a major issue. Drug nutrient depletion, drug-drug interactions, and drug system interactions, they all play a major role in your ability to have a good, concentrated, healthy body. I bet you never thought about it. A lot of healthcare professionals just kind of really, you know about it, you hear about it, but you don't really talk that much about it. You don't have as much time to talk to your patients, but guess what? I do, right here. You're listening to me right now, and I can give you the leverage, the extra benefits of knowing what is necessary in the marketplace. And one of the key things that I think is necessary is a program where you can actually talk to your pharmacist, look at your pharmacist, communicate with the pharmacist, and what better activity than Facebook Live right here like we're doing right now. And that's what motivates me, gives me a charge, makes me feel good at the end of the day, because I know that you have been listening and you have the knowledge and you want to know the answers. Otherwise, you would not be on this Facebook Live presentation. So again, my name is Tom Jones. I'm the pharmacist. We will have our second session of the day a little bit later on. It will be called Tom Jones Pharmacist. It will be live, and it will be tonight concerning menopause. And I will be coming up with that little presentation in just a few minutes. I thank you so much for being here with me. I really appreciate the opportunity to give you just some more information that you can take with you. Knowledge is the key. Being able to develop a healthy, good, personal lifestyle that takes advantage of all the things that we have to offer here in America. And life is so good. Life is so good. But it's not good if you are sick, if you are under the weather, if you don't feel good. So that's our purpose. If you have questions, just absolutely leave the questions here. I will be more than happy to answer them. If you have a program that you would like for me to put on, I'm here twice a day, every day, and we love you all. Good night, and I'll see everybody maybe even tonight. So thank you much, and I'll see you later. Bye.